Let us today learn about nursing audit. Quality of care can be described in the documents maintained for the patient care. Documents play a vital role. Documentation is a legal evidence of the healthcare services provided at the hospital, used to improve the quality and accountability of hospital for its accreditation. Incomplete documentation could impact quality due to unable to identify the progress of care, and patient complaints cannot be handled in an effective way. Audit is one of the management tools used by healthcare professionals, especially nurses, in order to assess the quality of nursing care and the cost of providing the care. Nursing audit is a professional evaluation of the quality of nursing services provided by the nursing staff by assessing the records. It is a process of analyzing data that assess structure, process and outcome of nursing care. A nursing audit is a systematic and critical examination of patient records, nursing notes, nursing records and reports, other documents for an evidence in order to evaluate and quality of the care. Purposes: audited helps to identify discrepancies between what is done and what should have been done. Purpose of nursing audit is to evaluate the nursing care. Nursing audit can be used as quality control tool, as a component quality assurance or quality improvement. Now, what is standards? Standards state the expected level of performance of an individual or a facility or a healthcare system. A good standard is realistic, reliable, valid, clear, and measurable. Clinical care standards should be based on the best scientific evidence available. The definition of quality standards also includes stakeholders' perception, that is, patient and community. If standards do not exist, practitioners must design or adapt as per their need and refine them. Objectives of audit: to study the quality patient care against the defined criteria, justify the cost incurred, and to take remedial action if there is any improvement required. Advantages: quality index can be assessed, patient is assured of good services, get information for strengths and weaknesses, and staff efficiency and the workload. Accountability of activities: self-assessment by the staff, reduce medical legal issues, evaluation and outcome of services, and cost effectiveness. But disadvantages: some people think it's a source of punishment and medical legal importance. They feel that these will be used against them in the court of law. Type of audit: retrospective, that takes place after the patient is discharged. Concurrent, while the patient receives the care. Prospective refers to audit done before the care. Outcome audit evaluates the outcome of the care, assumes that achieving the desired outcome will result in quality patient care and its expectations. Evaluation: process audit evaluates an intervention performed as per the standard or as per the procedure manual. Structure audit: evaluation of environment, infrastructure, human resource, equipment, supplies. Procedure: during nursing audit, nurse administrator investigate the nursing records thoroughly. These records can be assessed for the quality of the services delivered, quality of the document, their completeness, and identify the area of the cost care where it is going high, so that the justification can be given. A committee is formed with the approval of authority. Chairperson is the head of the nursing. They nominate 3 or 4 senior nurses. Wards and units are divided and visits are planned. Standards are reviewed and modified if required. Formats for observations are reviewed. Schedule for meeting is planned. Meeting once in a month or twice as per the feasibility to discuss. Visit the ward or the units. Feedback is given to head of the nursing and discuss the issues. Feedback is given to higher authorities. Action plan finalized and submitted for approval. Then action plan is discussed and implemented for bringing any change, and again the audit is being done. One of the main issues faced by the nurse administrator is mainly non-availability of nursing notes, as it is not routine in many of the hospitals. Steps, standards for outcome process and structure, nursing audit assessment of records and care, compare with set standards, identify strengths and weaknesses, give feedback to stakeholders, plan action, and re-evaluate. Three types of evaluation: retrospective, concurrent, and peer review. Retrospective, it means relating to past events. It is the evaluation of patient records after discharge, use post discharge questionnaire, patient feedback, or chart review. Concurrent, it is the evaluation of patient's health care while the patient is still receiving the care, use interview, direct observation of patient care, review of clinical records and nurses records. Peer review, in nurse peer review, nurses of same cadre or post do peer appraisal for the quality of care. It is based on pre-established standards or criteria. Then documentation. Documentation is the legal proof of implementation of care in the hospital. Nursing care documentation is conducted as evidence for nursing care interventions. Therefore, it's for the safety of the nurses and the patient. It is beneficial for the hospital to improve standard, create indicators of service quality, and provide evidence of accountability. Nursing audit must be conducted continuously to investigate the quality of the care. These are some of the references which can be seen by the students. I hope the nursing audit is clear to you. What are the advantages, what are the processes, and why it is important to